We look at about the GB39 is the most very crucial point. So in fact the point is located midway between the peroneus and peroneus longus tendon, midway between the two tendon the point is located here. You just look at that 3 chone proximal to the tip of the lateral malleolus is GB39, right? And then GB38 the point is located 4 chone proximal to the tip of the lateral malleolus. The point is located, right? GB38. 39, the major physiology is, it is the influential point for the bone marrow. When we look at about the bone marrow, there is not all the bones having the bone marrow, only the specific bones having the bone marrow. Bone marrow in fact is the very good because of inside the bone system, the marrow, the spongy kind of the substances which is accumulated inside the bone. You remember that is essential when it produces most of the stem cells in our body. Where all the stem cells are accumulated? Inside the bone marrow itself, inside the bone itself. So therefore these stem cells are converting or releasing all the blood cells in our body. For instance, the red blood corpuscles, which is essential for the supply of the oxygen to our body. When we look at about the white blood corpuscles also it releases, that's essential for the lymphatic system and also for the defensive mechanism for our body. When we look at about the platelets, so that also essential to regulate and control our bleeding. So all these things are, all 3 types of the blood vessels are secreted by the gallbladder, 39 region, especially by the bone marrow. Therefore whenever you find there is a problem in the blood cells, you remember to activate, especially the red blood corpuscles are released by the even GB39 also and kidney 3 also. The kidney and then gallbladder 39 points are good to treat for the red blood corpuscles. No doubt the stem cells are deficiency with all the cells. When we look at about the different anemia, iron, the aplastic anemia, iron deficiency anemia, or we call as a sickle cell anemia. So iron deficiency anemia, so many 7 types of the anemias are there. Even that anemia is the reason when you activate the gallbladder 39 point is good to treat for the any kind of the blood disorders. If you add up along with that point is called as a Keshu. Keshu point is UB17 point is the influential point for the blood. This is the influential point for the bone marrow. If you add up both the points, because of UB17 point, Keshu point is midway between the Pishu and then Kanshu. Then you understand midway between the liver and spleen the point is located. Where the spleen is the storage of the blood taken place, at the same time liver is storage of the blood is taken place by the liver and control of the blood to be taken place by the spleen. So both in between the point is located is the Keshu point. So therefore this together, if you add up anything, the blood related diseases can be treatable. You understand when we have the sick, so that time immediately the hospital goes and they take our blood to identify the pattern of diseases. So therefore once you keep activating this point for the prevention purpose and for the therapeutic purpose, always is good for the treat for the numerous diseases related to the known and unknown cases of the diseases. When this doesn't work, when you look at about the leukopenia, so leukopenia it is kind of the white blood corpuscles, it causes the problem, deficiency, it leads to the various diseases. When thrombocytopenia, there is the platelet is deficiency which leads to the bleeding disorder. So in the similar way, so many diseases related to the blood also can be treatable by activating to the GB39. There are the bone marrow also 2 types. One is the red bone marrow and then yellow bone marrow. But mostly the red bone marrow is essential to produce all the blood cells in our body through the stem cells. right? So therefore you remember, whenever you feel there is a imbalance or weakness and lethargy and fatigueness, and the person is suffering for the malnutrition, even that condition, this point is abundantly good. At the same time, this GB39 is the distal point for the nape and then cervical region. When the patient is complaining there is a shoulder pain and cervical pain, remember to activate the two most distal point for the shoulder and nape and then cervical region. That point is Tioko. Tioko is the stomach 38 point, and then Swanchung. Swanchung is the GB39 point. Together you can activate this point. Certainly there is abundant relief for the cervical related issues, right? So therefore this is the tonic point to our body.